We'll give about 1 more minute and then we'll get started. Maybe I should have had music while we waited, huh? Note to self. Well, all right. I guess we can start and people can jump in as necessary as we move forward. I wanted to welcome everybody to the first quarterly meeting. My name is Tamara Baca. My pronouns are she, her, and all, and I will be facilitating the meeting today. I got some housekeeping rules I just want to go through. Please mute your computers. The speaker will be given some pre-selected questions, and questions will be allowed at the end of the presentation. The meeting will be recorded and can be viewed on our Facebook page. It is my pleasure and honor to introduce our esteemed guest speaker. Julia Wacloff, who is the program administrator for access to care for the Arizona Department of Health Services Office of Oral Health. She works with state and local agencies on a variety of public health functions as related to oral health. She currently holds a position of past president for the Association of State and Territorial Dental Directors and serves as the lead epidemiologist for the Surveillance, Investigation, and Research Team with the Centers for Disease Control and Prevention Division of Oral Health. She has over 15 years experience in various public health settings, providing needed needs assessments, policy development, and quality assurance at local, state, and national levels. She has earned a master's degree in dental public health from Boston University, a bachelor's in education and associate's degree in dental hygiene from the University of Minnesota, and at a certificate in epidemiology for Arizona State University. Thank you, Julia, for attending, and I'll let you go from here.
Great, thanks, Tammy, for the introduction. I'm going to share my screen. But I see we have a fairly small group. I see some names that I recognize a lot, and then also don't. So if you wouldn't mind putting your name and your organization or agency in the chat, that would be great, just so we can have an idea of who's all here. Tammy, thumbs up, you can see my slide. Okay, great. So welcome. I'm excited, very excited to share this information with all of you, and thank you for having me today. Actually, you're the first individuals to see this data, so very exciting to share the information. This should only take about 30 minutes since it's such a small group. We'll keep it fairly informal. Tammy says save questions to the end. That would be great. And then we'll also open it up for further discussion. So a little bit about our office. The mission of the Office of Oral Health is to improve the oral health for the well-being of all Arizonans. And our state priorities include several strategies. So one is increasing access to care. And through this, we focus on workforce development, education on the importance of social determinants of health, particularly for providers in clinics, and then expanding evidence-based approaches such as community water fluoridation and school-based sealant programs, integrating oral health with primary care, which I know a lot of our partners are also involved in, and building a robust oral health surveillance system. So we have the ability to monitor oral health conditions and have comparable data across states. Some of the healthy, or these aren't quite all of the Healthy People 2030 oral health goals, but I did want to share these with you because these are really what our drivers are for how states are measured on advancement in oral health. So reducing tooth decay, excuse me, both in children, adolescents, and throughout the lifetime. And then for older adults, it's reducing untreated root surface decay. Reducing periodontitis, and the focus again is for adults ages 45 and up who suffer from moderate and severe periodontitis. Reducing overall tooth loss, so reducing the proportion of adults aged 45 years and over who have lost all of their teeth. Increasing access to dental care, so increasing access to these services and with an emphasis on preventive services. So primary prevention, and then promoting prevention strategies, those two evidence-based strategies that we have, which is community water fluoridation and school-based sealant programs, and then detecting cancer at its earliest stages. So increasing the proportion of oral and pharyngeal cancers detected at the earliest stage. For this update, I'm going to be sharing primary data that our agency collects. So these aren't secondary data sources that are gathered by other organizations. So there's probably other information out there as well. But the focus is on these populations of children, pregnant women, adults, providers, and then to share the latest that community water fluoridation in the state. So a few statistics that I'd like to kind of frame for you of where we sit in the nation. We're 8th in the nation for overall population growth. So we're geographically the 6th largest state in the nation, and we share a 389-mile border with Mexico. 46% of the population belongs to racial and ethnic minority groups. Over 45% of the children birthed to age 5 in Arizona are Hispanic. 18% of families with children are living below the poverty line. 45%, and when you look at disparities, 45% of Native American children live below the poverty line, 35% of Hispanic children, and 30% of Black children live in poverty. 11% of Arizona adults have been diagnosed with diabetes, and this is an estimated 34,400 new diagnoses a year. And we're 31st in the nation for percent of adults with cardiovascular disease. So this is about 391,000 adults. So you see, there's great opportunity for promotion and expansion of reach. Back in 2019 to 2023, we implemented what is called the Healthy Smiles, Healthy Bodies assessment. And this is an oral health assessment that is done in public schools across the state to get a broader look at what the oral health needs are of kindergarten and 3rd grade children. We started in 2019, expecting to be done in 2020, and then we all know what happened in the spring or late winter of 2020. COVID hit, and this really put a stop on those oral health assessments. So they were conducted over the course of 4 years or 3 school years. We reached 14 of 15 counties. One of the counties we could not engage to participate. The schools, we couldn't get them engaged to participate. So we have limited data on 14 of the 15 counties. 99 schools participated, and as I mentioned, these were public and charter schools across the state. And our focus was on kindergarten and third grade children. And I'll get to why we focus on those two groups a little bit more. So this is a wrong number in there. I'm sorry, but it should, I don't know how it got converted, but we conducted over 9,700 oral health screenings. And the oral health indicators that we gather information on are treated tooth decay, untreated tooth decay, dental sealants, and treatment urgency needs. So the first group I'm going to give you a snapshot of is kindergarten children. And this is seen as an indicator for school readiness. So assessing what the oral health status of children are as they enter kindergarten. One of the findings is that half of Arizona kindergarten children have a history of tooth decay. This is higher than the national average for 5-year-old children. So it's 1 out of every 2 children have either had have treated or untreated tooth decay. Almost a quarter of Arizona's kindergarten children, 24%, have untreated tooth decay, which again is higher than the national average for 5-year-old children at 17%. The next category that age that we focus on is third grade children. And the reason this is a target age is this is when a child is most likely to have their first permanent molar in their mouth. And we know that first permanent molars are predictive of later oral health status. One of the findings was that more than 6 of 10 third grade children, or 63%, have a history of tooth decay, which is higher than the national average for 8-year-old children, which is at 55%. For untreated tooth decay, almost a quarter of Arizona's third grade children, 24%, had untreated tooth decay, again higher than the national average for 5-year-old children at 17%. About 1 out of 3 Arizona third grade children have dental sealants, which is lower than the Healthy People 2030 target of 43%. So it's about 1 out of 10. And nearly 8 out of 10 children need at least 1 dental sealant. So the measurement of dental sealant prevalence is whether or not they had at least 1 dental sealant. But then we assess those teeth that need additional sealants, for example, if they don't already have a sealant or if the tooth is not already decayed. And 77% of our children could use at least 1 or more dental sealants. We know that disparities exist. So children living in rural counties and those attending lower income schools are more likely to have decay. So the top 2 bars show you rural versus urban percentages. A higher percentage of rural children have tooth decay than urban. And the 50 to 75, those are free and reduced lunch percentages. So the higher the free and reduced lunch percentage, the lower income the school is considered to be. We also found that American Indian, Alaskan Native, and Hispanic children had the highest prevalence of decay experience and tooth decay. So the decay experience are the bars on the top of the graph. You can see for American Indian and Alaskan Native, they're at 88% versus 62% for Hispanic and 48% for non-Hispanic white. And for untreated tooth decay, it was 48% for American Indian, Alaskan Native, 28% for Hispanic, and 20% for non-Hispanic white. Some trends that we're noticing. So there was a significant decrease in the percent of third grade children with protective sealants. So this indicator, our statuses were getting worse. Our target is 42.5% or 43%. The increase is desired in this. So you can see these are our surveys that have been conducted in the past. During 1999 and 2003, we were at 36%, which is higher than the rate we're at now. In 2014, 2015, we were at 44%, and then we declined. And this could be, anecdotally, we don't have any solid proof, but the advent of COVID and the inability to reach that population in need. Another trend in the percent of children with decay experience and untreated decay is that we've had little or no detectable change. We have a decrease, which is desired. And you can see on the bottom, we have kindergarten untreated, third grade untreated, kindergarten decay experience, and third grade decay experience. While you can see there has been a trend down, it was considered to be not significant based on the parameters of the survey. And I apologize for this table, but I did want to share it with you. I was hoping my maps people would have had a beautiful map for me to show you. But you can take a look at by county what decay experience and untreated decay look like. We had a high of decay of experience in Coconino County at 82%, and then a high of untreated decay at 59% in La Paz counties. We also took a look at needing dental sealants, and again, 92% was a high in Pinal County of percent of children that need additional, at least one or more dental sealants. We will be coming out with maps, and this report will be put on our website, and as soon as it's available, I'll make sure that our pretty maps that map out this information, as well as the report, is shared with the coalition and its members. A few of the things that we like to do is use some social math for getting our message out. So one of the things that we did is we took a look at the number of children in K and third grade needing dental care. And according to this, it would fill more than 1,890 school buses. And if we lined up those school buses end to end, they would stretch for over 16 miles. So I put in there approximately from Phoenix to Chandler. And I'm sure you can all relate to what 16 miles is, but this is a huge number of children that need dental care. We also took a look at treatment urgency. So treatment urgency is whether or not that child is in urgent need of care, meaning they have pain and or infection, such as an abscess. And on any given day, the number of kindergarten through third grade children needing urgent dental care because of pain or infection would fill half of Chase Field. So imagine if we could all get them into Chase Field and treat them all, how wonderful that would be. We'd need a lot of providers for that, wouldn't we? So I'd just like to share some of the key findings and some strategies, some opportunities and challenges that we have to address. So by the time Arizona children, when they enter kindergarten, 1 out of 2 or 50% have experienced tooth decay. And we know that that prevalence continues to rise. We only have it measured up until third grade. But as we know, the later on you go in life, the more likely you're to have a tooth decay experience. And by third grade, it's at 63%. So what are some of the strategies we can implement throughout the state? So we know that early prevention efforts are critical to address disparities and to primary prevention of tooth decay. And looking really for those early prevention efforts at pregnant women, infants, toddlers, preschoolers, and elementary school children. So getting them before the disease starts. Expanding awareness is also very important. So teaching parents about the importance of brushing young children's teeth with fluoridated toothpaste and beginning when that first tooth erupts in the oral cavity. Also looking at what health promotion messages should focus on is limiting the sugary foods and drinks, and kind of getting a twofold out of this. So while it helps to prevent tooth decay, it can also address some of those chronic diseases such as obesity and diabetes in our populations. And then early dental visits, establishing that dental home by the age of 1 and continuing out through the lifetime. And then medical and dental integration. So including fluoride varnish as part of the medical well child visit in preschoolers would help reduce decay. And I know many of our partners have been working on these efforts for many years now, and how we can promote that and expand that as well. Another key finding is too few children are protected by dental sealants. We know this is a safe, effective, simple, cost-effective, money-saving way to prevent tooth decay on those permanent molars. Only 1 out of 3 Arizona children have sealants. This suggests that more dental sealant programs targeting elementary school children are needed. As you all are aware, dental sealants are thin coatings that are painted on the chewing surfaces of permanent molars that it can prevent tooth decay for many years. So around this, one of the challenges we have is creating awareness about the need for dental sealants. So not only among parents of children, but school administrators, school nurses, teachers, those that really have the ability to increase that access to that preventive service. And then also, in addition, efforts should be made to encourage or incentivize dentists to place sealants on permanent molars. As you are aware, preventive services are usually reimbursed at a lower rate than restorative procedures. So taking a look at how can we create an incentive or a buy-in to promote these preventive services. Now we'll move on to adults. What do we know about adults? So one of the key resources we use for adults is the Behavioral Risk Factor Surveillance System. This is a phone survey that's done with adults across the state, and it focuses on tooth loss and dental visits, but also it collects information on other chronic diseases. So we can take a look at these oral health indicators related to other chronic diseases as self-reported by adults who participate in this survey. We have 1 out of 10 adults have had all their natural teeth extracted. This is a huge number. It might not seem to like 10% is a lot, but that's a huge need for care. As I'm sure you're aware, at the Mission of Mercy, it seems like that's the first service that we run out of dentures. And 4 out of 10 adults have had at least 1 tooth removed. When you take a look at this, as far as tooth loss by smoking status, those that are current smokers, meaning they smoke every day or not as frequently as every day, and also former smokers are more likely to have tooth loss compared to those who have never smoked. Another chronic disease indicator, as you're aware of, is diabetes. And taking a look at the prevalence of tooth loss for those individuals who have been diagnosed by a physician with diabetes or who do not have diabetes. So those that have been diagnosed with diabetes are more likely to have either complete tooth loss or partial tooth loss. The next category I'd like to share with you is pregnant women and what we know about pregnant women. And this information is gathered from the Pregnancy Risk Assessment Monitoring System. This is a system that every state in the nation implements, and it collects health behaviors for women during preconception and postpartum, as well as demographics on those women. And one of the indicators is dental visits, of whether or not pregnant women are getting dental visits. And you can see that the majority of pregnant women had no dental visit either during pregnancy or after pregnancy at 58%. Only 32% had a dental visit during pregnancy, and 10% have a dental visit after pregnancy. And we know we want to encourage these dental visits during pregnancy, because as you can see, getting that dental visit in after the baby is there becomes much more difficult. The other indicator we look at and monitor is the number of health professional shortage areas, and it's done for both primary care and dental. We do also do it for mental, but I only included primary care and dental to kind of show you where our opportunities for outreach are. Currently in Arizona, we have 558 primary care shortage designations and 381 dental shortage designations. And if you take a look at this map, those shortage designations are given a score. So the lower the score means the higher the provider to population ratio is. The darker the color, that means the areas where we need more providers. These are the dental HPSAs across Arizona. As you can see, our rural counties have high dental HPSA scores, but if you also look at the pullouts for both Metro Phoenix and Metro Tucson, there are areas within these urban communities that also have dental HPSAs. The last thing I'd like to share with you is community water fluoridation. And if you look up our community water fluoridation status with the CDC, we're currently at 58%, but this figure has not been redone in a while, and we've recently lost 2 communities that have stopped fluoridating. So our current communities that adjust to optimal levels, you can see it's a handful: Chandler, Gilbert, Glendale, Guadalupe, Mesa, Tempe, Peoria, and Phoenix. So those systems are adjusting or adding fluoride to the water. But then we also have a great number of communities that have naturally occurring fluoride that are considered to be at optimal levels. So Apache Junction, Gila Bend, Goodyear, Sun City West, Nogales, Eloy, Casa Grande, Douglas, Litchfield Park, Surprise, Kingman, Catalina, Fountain Hills, Fort Huachuca, Scottsdale, Lake Havasu, and Sun Lakes. So quite a few that have naturally occurring systems. Unfortunately, 2 communities have recently, in the past few years, stopped fluoridating. Bisbee has stopped and completely removed it from their water system, and Yuma has, while they voted it in, has stopped without any explanation of why it was discontinued. So those are the brief statistics I have to share, and I'll pass it off to Tammy for
All right, so
take over.
right on. I'll take over now. So I just got a couple questions to ask you, Julia, and then we can open it up to everybody, because there was a lot of great information in there, and I even have more questions, but I'll let people do it. So did any of the data surprise you? And if it did, what was it?
did it surprise me? Well, I was surprised to see that we hadn't made any improvements over the last several years. That being said, I had a suspicion that COVID was going to impact us, but again, that was anecdotal until I saw this data. And again, I can't say it's a cause of the decrease in the prevalence of sealants, the non-significant decrease in decay experience and untreated decay, but it looks like it may have had an impact on reaching children.
Yeah, okay, and then, and you kind of answered the second question, why so much decay in children? Well, I wanted to know, why do you think there's so much more decay in children? And you had kind of answered it with the COVID, probably leading a lot to that, because I know I saw in the community health centers, the lack of brushing teeth during
Mhm.
that time. And then my final question would be, most community health centers have pediatric dental integration, and we're still seeing large numbers of children with decay. Do you feel that they are taking the time to truly educate the patients, or is the focus, and I hate to say this, on the bottom line, on let's see as many patients as we can to help fund some of our adult programs? So go ahead.
Sure. Well, first of all, I don't want to comment on how community health centers are doing. I don't know that there's been like an official evaluation on that, but I do know there's opportunities statewide for us to promote oral health across many different populations and increase oral health literacy and increase the awareness about the importance of oral health. So I can't comment on the individual community health centers. I mean, there are boots on the ground out in the communities helping to address health disparities. But I think there is opportunity for us to expand outreach, expand promotion, and really promote prevention strategies. Anything else, Tammy?
No, that was unmute my, I'll let some people ask questions. If they have some, you can go and unmute and go and ask questions if you want.
Hey, Julia, are there any areas in Phoenix that are naturally fluoridated, or because Phoenix wasn't on the list? And
Oh, Phoenix is one of the systems that is currently fluoridating.
okay, so it's adding fluoride.
Yes.
Now
correct.
the list that you know, Fort Huachuca and all the cities are those are natural, so they don't have to add.
Correct. Yes.
Okay.
They have natural levels that are at that 0.7 parts per million that meet those requirements.
It was a really good information, like consolidated into bite-sized pieces for, you know, what we consider. I really appreciated it.
Oh, great. Thank you, Barb.
Hi, Julia.
Hi.
Good to see you. I know. I know that you spoke a lot about dental sealants and the dental sealant program. Can you talk a little bit more about that engagement with the schools? Is that decreasing? Is there an issue there where we need more coordination with the schools?
Yeah, well, you know, we've been trying to rebuild programs in schools since COVID. COVID really, well, of course, stopped all programming, and then rebuilding those relationships has taken some time. But I will say that there is a lack of awareness about the importance of dental sealants in this population, either by school administration, school nurses, or in teachers, that there's an opportunity to expand the outreach there as well. How that's done, you know, that's the $1 million question, and I wish I had a crystal ball. But also, I think promoting the message around how oral health in childhood impacts oral health as an adult, and relating it to what can we do to be better communicators, how preventing tooth decay now as a child will impact their oral health later in adulthood. So
Yeah, and I know that messaging we've worked on quite a bit, and I think it's a consistent battle of just trying to make sure that messaging is everywhere, and it's both providers and school level parents, everything that we can do, but it takes resources.
yeah.
So when I was at Maricopa County, and Tamara, good to see you as well, by the way. So you know, it took an individual to help motivate and accelerate that. So I think it's really sometimes how can we bring someone in to really advocate for that within these programs and within the schools and providers?
Yeah, that's a good point, Vince. Developing those personal relationships and touch points with schools is very important. Especially when they have such a high rate of staff turnaround as well. And schools have their own challenges to address. Keeping children in chairs, testing, then, you know, nurses are dealing with everyday illnesses and injuries that come into their offices.
Yeah, yes. Yeah, I know. And is Yavapai the county that was not part? Okay.
Yes, yeah.
All right. Thank you, Julia. This was a good, just a good presentation.
Oh, thanks, Vince.
I'd like to talk off of Vince's real quick. One of the things I noticed is once a lot of like what Vince was saying, a lot of the programs getting into schools, when I was at one of the other centers that I worked at, one of the goals was to try to get the education back into the school. And the hardest part was to make the connections between, like, some of the schools were so locked down on stuff, it was hard to get in. And just even going to the third grade classes. And that's one of the things that's like a focus that needs to probably go back into the schools, because I know just what I see is that there's just not enough people going into schools and talking to the parents and everything about, hey, this is what needs to happen. I mean, the diet, and then they come in and they have so much decay in their mouth. So it's pretty sad.
Mm-hmm.
Anybody else want to say anything?
Well, I see Lorraine and Danelle on the call. They could answer your question about the community health centers. I don't want to put you on the spot, but
And I'll put some info in the chat as well of the percentage of
great.
dental sealants that we see at health centers.
Wonderful.
Yeah, that's the big thing, though. The main thing that we need to focus on is education. And we have that little snippet of chance in the community health centers through integration to talk a lot about that education through, you know, putting out, you know, little sheets or whatever and showing them what decay looks like, because you could talk to a parent about decay, but unless you actually show them what it looks like, then they're really not knowing what they see. And that's the main thing. That was more like I wanted to talk about that because of the community health center and stuff like that. I do have a question. I have a bunch of questions.
Sure, Tammy.
So so when you talked about adults and the tooth loss and the smoking, is there any data that's coming out now about cannabis use? Because our state is now cannabis, and I have seen in the mouth, and I don't know what else to do with my patients because it is such a different kind of tobacco. I mean, it's different than tobacco, and what I'm seeing is a lot of like cobblestoning of the soft tissue, and the roof of the mouth is really whitish. And I've only told my patients, like, hey, if you smoke cannabis, I need you to rinse after you smoke. Do you know if there's any data that's out there on it or information you can maybe get me?
Great question. I don't have any information on that, but I know I can reach out and see what I can find out. That would be a really important area to start some detailed surveillance on as well. Great question, Tammy. Thanks.
Feel free to send out any more questions, anybody.
Just real quick, Julia, I don't know if you know this, but is there any updates on the network adequacy across the counties? How does that come across?
Do you mean
Dental
related
providers.
to health professionals?
Well, anyone who provides oral health services, like, so is there any update? How do we get that update on some of those rural areas where maybe it's more preventative focused? What does that include and what does that entail?
You know, that's a great question, Vince. I wish we had more detailed information because the health professional shortage designation is very limited as far as what is looked at. It looks at whether or not a dental provider is providing services to Medicaid population, also their age, whether or not they have auxiliaries, and it's really used to influence participation and drive loan repayment. So that's the only real measurement of adequacy that we have, other than our sliding fee scale clinics and also FQHCs that are across the state.
All right. Yeah, it seems complex, right? So, you know, the different layers of providers and services and preventative versus restorative. So I just wondered if there was any kind of update there. But thank you.
Yeah, unfortunately not. Great question though. And I wish we had the capacity to do more surveillance on all of these indicators to get a better, fuller picture of what's really happening and driving the oral health status of the population.
So there was something in
Agreed.
the chat from Danelle. She said she had to hop off quickly, but wanted to add that recent new access point funding released by HRSA, which has been available, it hasn't been available in a while, and it's highly competitive, but hopefully we can see some additional CHC dental access points in Arizona as a result of the funding. So yeah, this will be recorded and hopefully this gets out to some of the dental directors. I wish there was a few that maybe had showed up, but don't know where they went.
Well, oh, Tammy, I think you're talking, but you're on mute.
Sorry, my friend. Sorry, I put myself on mute and then took myself off. Go ahead, Julie. I'm sorry to interrupt.
Oh, I have nothing more to add, but thank you for having me and just letting you know you're the first to see this information, and I'll be sure to share the link to the report. Thanks.
I really appreciate your time and everything you did for us. It was a very great and informative talk. Thank you.
Thank you as well.
Thank you, everybody.
Bye.
Bye.